Hi.
My name is Therese, and I'm going to be your nurse today.
Alright.
So today we're just doing a head-to-toe assessment. I'll explain it to you as we go through it, and if you have any questions along the way, just feel free to stop and ask me.
Alright.
Can you tell me your name and date of birth?
Nick Rivard, July 16th, 1998.
Okay, and I can see that's correct with your wristband, so I'm going to wash my hands. And can you tell me where you are right now?
Bay College Hospital.
Okay, can you tell me what month it is?
March.
And what year?
2020.
Okay, so I can see that he's alert and oriented, he knows where he is. His speech is clear, no slurring. His pattern of speech is articulate and it's appropriate to the conversation. His mood is pleasant, his affect is also good, there's no flatness to that. His facial expression is appropriate. He doesn't appear to be anxious or in any distress. Are you in any pain right now at all?
Nope, no pain.
Okay, and I can see that his posture is good. He's upright in a chair, and his motor activity is also good. So I'd also take his vital signs at this time, which would include blood pressure, heart rate, respirations, O2 saturation, and temperature. And throughout this assessment, I'm going to be looking at your skin for any breakdown, which might include sores, redness, bruising. I'm going to assess your skin turgor. And a common finding in elderly people is a decrease in elasticity when you see that. And tenting when you do skin turgor is a sign of dehydration. And I'd also assess capillary refill, which is less than 3 seconds. Alright, so we're going to start with his head. Just inspecting it. I don't see any masses or lesions. His head is proportional to the rest of his body. When I palpate scalp and his skull, there's no masses or lumps. I don't see any lesions there again. And there's no sign of a battle sign or raccoon's eyes, which are indicative of a skull fracture. Looking at his hair, it's evenly distributed, it's healthy and thick, and there's no signs of alopecia. And I'm going to palpate your temporal arteries, which are palpable. And can you clench your jaw? And I'm also assessing his temporomandibular jaw. Is there any pain or tenderness when you clench that?
Mm-mm.
Okay, so no TMJ there. And I'm also assessing his sinuses. Do you have any pain or tenderness?
Nope.
Okay, and his sinuses are not swollen at all. I'm also going to assess cranial nerves 5 and 7. So if you could clench your jaw for me. I can see that his chewing muscles are intact, which would be the masseter muscle here and the mandibular. And open your jaw against resistance is intact. And then I'm also going to have you pull some faces, so if you can smile, frown at me, and lift your eyebrows. So both those cranial nerves are intact as well. So next we're going to move on to the eyes. Just inspecting them, there's no redness or drainage. They align well on the face and they're symmetrical to each other. Looking at the external features of the eye, the eyebrows are healthy, as are the eyelids. They're evenly distributed. The eyelids, there's no drooping or swelling or redness. And can I have you look up for me? Okay. I can see that his conjunctiva is pink and that his sclera is white. And I'm also looking at the cornea, the lens, and the iris, which all have good color and are in appropriate. So now I'm going to assess your pupils by just shining this light in your eye. Okay. And then I'm going to have you follow my pen light in. Okay. And by doing that, I can see that his pupils are equal, round, reactive to light, and they accommodate. I'm also going to look at your corneal light reflex. Okay. So when I shine a light in his eye, I can see the reflection in both eyes. And right now we're testing cranial nerves 3, 4, and 6. So now we're going to do the confrontational visual testing. So I'm going to have you cover one of your eyes. And then just tell me when you can say now when you see the pen light come into your view.
No. 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 No.
Okay. So I can see that his peripheral fields are intact. I'm also going to look at the cardinal fields of gaze. So if you could just follow the pen light. Very good. And if I had an ophthalmoscope, I'd be looking at the retina. You should be able to see the red reflex and the optic disc, which should be a orange-pink color. And we're also going to assess cranial nerve 2. If we had a Snellen chart, I would have him stand 20 feet away from that chart, cover one eye, and be able to read the smallest letters that he could. And that would test his visual acuity. Some changes that you might see in the geriatric patient would be presence of arcus senellus, cataracts, and a decrease in visual acuity. Alright, so now we're going to assess the ears. So first, I'm just looking at them to inspect them. I don't see any lumps, redness, or drainage coming from the ears. When I palpate the auricle and the tragus, again, no lumps or masses. If I had an otoscope, I look inside the ear and make sure that the auditory canal is patent, and then I could see the tympanic membrane, which should be a pearly gray. And we're also assessing cranial nerve 8 here, which is responsible for hearing. So I'm going to cover one ear, and then you can tell me what you hear.
Apple. Car.
Okay, which was correct. And I'd also do the Ryan and Weber test, which would test bone and air conduction. Right, next we're going to move on to the nose. So just looking at it, I don't see any redness, masses, lesions, or drainage coming from the nose. It's symmetrical to the face. When I palpate it, I don't feel any swelling or masses. You could tilt your head back for me. Okay. I can see that the mucous membranes are pink, the nares are patent, and that the septum is midline and not deviated at all. Alright, next we're going to move on to the mouth and the pharynx. So first, just inspecting, I can see that his lips are pink and appropriate. If you could open your mouth for me. Okay, I can see that the mucous membranes are pink and moist, both on the top of the mouth and the floor of the mouth. The teeth are aligned well. The tongue is pink. There's no signs of thrush or whiteness on the tongue. I'm also going to be assessing cranial nerves 9, 10, and 12 here. So if you could stick out your tongue for me, move it side to side, up and down. Okay, and then can you say ah?
Ah.
Okay, and I can see that uvula move up, and this is also where I would test his gag reflex, as well as taste on the anterior and posterior part of his tongue. Alright, so moving on to the neck. First I'm going to inspect it, make sure it's symmetrical, there's no lumps or lesions. And palpating it, I don't feel any masses. I'm going to feel his trachea, and I can feel that it's midline. Any deviation from that could mean spontaneous pneumothorax. I'm also going to palpate his thyroid, so if you could swallow for me. Okay. And the thyroid is normally not able to be felt, so it's not enlarged, which is good. Okay, and I'm also going to just palpate your carotid pulse. Okay. Both are palpable and strong, and I'm also going to listen for a bruit there. Which was not heard. A bruit is not normal. It can be indicative of arterial stenosis. Okay, and I also want to see if you have good neck range of motion. So if you can put your chin to your chest, back up, and then your ears to your shoulders, both sides. And then if you could just put your neck in a circle. Perfect. And we're also going to assess cranial nerve 11 here. So if you can lift up your shoulders. Okay. And then tilt your head against my hand, both sides. Okay. And that nerve is intact. And we're also going to palpate for any cervical lymph nodes, which are not palpable, and that is normal. And next we're going to move on to the anterior and posterior and lateral thorax. So first I'm inspecting his chest. I'm looking for any lumps. I'm looking for barrel chest, which can be a sign of COPD. I'm looking for symmetrical chest expansion and any use of accessory muscles, which I do not see, and that's a normal finding. So next I'm going to percuss in the lung fields. And this should be a resonant sound. Okay. And what she does have, which is good. And I'm also going to palpate for any masses as well as tactile firmitis. So as I'm palpating, I'd like you to say 99.
99, 99, 99, 99, 99, 99.
Okay, and tactile firmitis is a vibration felt when palpating. It can be normal in the upper chest and then decreases as you move down, which was the case for him. Okay, and now I'm going to listen to your breath sounds. If you can take some deep breaths for me. Okay, and the lung sounds were clear bilaterally. There's no presence of adventitious lung sounds, and his breathing is unlabored. So now we're going to do the same thing posteriorly. So you can just turn towards the window. Good. Okay. So again, I'm inspecting. I'm looking for symmetrical chest expansion, any use of accessory muscles, which I don't see. I'm going to percuss again, listening for that resonant sound. as well as palpate. You could say 99 for me.
99, 99, 99, 99, 99, 99.
Okay, and that was within normal limits again. And now I'm just palpating for any masses there. I'm also looking at his sinus process, making sure it's midline, without a curvature. And I'm going to palpate that, feel for any masses or lesions, which there's not, which is good. And I'm also going to assess his costovertebral angle. So I'm just going to put my hand kind of right underneath his ribs, and then I'm just going to knock on top of my hand. Do you feel any pain or tenderness when I do that?
Mm-mm.
Okay.
Nope.
And once again. Any pain or tenderness?
No pain.
Okay, so that's a normal finding. There should not be any pain there. And now I'm going to listen to your breath sounds again. You could take some deep breaths. Okay, lung sounds were clear bilaterally. No crackles, wheezes, breathing is labored. All right, so now we're going to, you can turn back towards me. I'm going to have you move to the bed so that we can assess your heart and your abdomen. So first, assessing his heart. I'm just inspecting it, looking for any heaves or lifts, which would not be normal. I don't see that with him. I'm also looking for any masses or lumps, redness. Are you having any chest pain?
Mm-mm.
Okay. I'm also looking at his neck muscles. So if you could turn your head. I'm looking for any jugular venous distension or pulsations, which I don't feel. And then the other side. Again, no distension or pulsations, which is normal. And we already assessed his carotid arteries and for a buoy there. So now I'm just going to palpate. And I'm feeling for the point of the apical impulse at the 5th intercostal space and the midclavicular line. And I can feel that, which is normal. And then I'm also palpating the precordium for any pulsations there, which I do feel, and that is normal. And now I'm going to listen to your heart sounds. So I listened at the aortic, pulmonic, Erb's point, tricuspid, and mitral valves. I heard S1 and S2 heart sounds. There's no presence of a third heart sound, which could be indicative of heart failure in an older patient. No thrills or gallops, and the rate was regular. Right. So now we're going to move to the abdomen. Is it okay if I pull up your shirt a little bit?
Mm-hmm.
So first I'm just inspecting. I'm looking for any masses, distension, any signs of ascites, which I don't see. And now I'm going to auscultate before I palpate so that we don't disrupt the bowel sounds. Bowel sounds are present in all 4 quadrants, and now I'm listening for an aortic bruit. That is not present, which is a normal finding. And I'm also feeling for a pulsation of the aorta, which I do feel, and that is normal. So now I'm going to percuss all 4 quadrants. And I'm listening for dullness here. And I'm also percussing the liver and the spleen, which should be a dull sound. And they are. And now I'm going to palpate. So first, just light palpation, feeling for any distension there, which I don't feel. The liver may or may not be palpable with light palpation, and the spleen should not be palpable at all. Do you have any pain or tenderness there? Okay. So now I'm just feeling with deeper palpation. Again, no distension, pain, or tenderness. And I'm going to palpate his liver again. Can you take a deep breath for me? Okay, and let it out. Okay. And it's not normal. It can be normal and not normal for the liver to be palpable. And the spleen should not be palpable unless it's enlarged. All right, so now we are going to move on to the extremities. So you could sit up for me if you'd like. So first I'm just looking at his arms. I'm looking for any bruising, edema in his arms or his hands. I'm going to check his skin turgor again, which is good. Good capillary refill. I'm assessing his radial pulse, which is palpable and regular, as well as his brachioradialis pulses, which are also regular. Can I have you squeeze your hand, my hands? Okay. He has good muscle strength and tone. I'd also assess his reflexes. So the brachioradialis, this reflex would be pronation of the hand. The bicep reflex would result in flexion of the forearm, and then the tricep reflex would result in extension of the forearm. And I'm also going to have you do some range of motion. So can you put your arms up? Okay, and then flip them over, put them above your head, and then draw them back down. Okay, very good. So I can see he has good range of motion there. Next we're going to move to his lower extremities. So first I'm just inspecting for any redness, lesions, bruising, edema. I'm just feeling top of his feet for any edema, as well as any pretibial edema, which I do not feel. I'm palpating for his pedal pulses, which are palpable, as well as his post-tib pulses, which are also palpable. He has good skin turgor in his feet, as well as good capillary refill in his feet, less than 3 seconds. So I'm also going to assess for reflexes here. The plantar reflex would just be stroking of the bottom of the foot, and that would result in dorsiflexion of the foot. And then the Achilles tendon would be plantar flexion of the foot, and the plantar reflex would be the flexion of the big toe. And then the patellar reflex would be the outward kicking of the leg. So I'm going to have you do some leg range of motion as well. You want to stand up. Okay, and then just bring up your legs. Very good. And then bring them out to your side. Okay, very good. If I could have you sit down for one more minute. And I'm just going to have you lift up your feet and then push down. Okay, so he has good muscle strength and tone there. We're also going to assess the coordination of first your arms. So first, can you put your fingers together individually? Good job. And then your finger to your nose and the other arm. Good job. All right, and then we're going to assess the coordination of the legs as well. So if you want to stand up, and I'm going to have you just turn this way, and then you can walk with, well, first you can put your heel to your shin, yep, and then the other leg. Very good. So I can see he has good coordination in his legs as well. And now we're going to assess his gait. So if you could walk forward with your heels to your toe. Okay, and then come backwards. Good job. So I can see that he has good balance. We're also going to do the Romberg test. So I'm going to have you put your feet together. Stand with your eyes closed. Okay, so that's good. So I can see that his proprioception is intact by doing that. And then I'm also going to assess for a pronator drift. So if you can put your arms out in front of you, just hold them there. Okay, that's good. So pronator drift is a not normal finding, and that would be if the arms were to drop or drift to the sides. And then I'm also going to assess his spine range of motion. So if you could just tilt to the side like that, and the other. Okay, and then bend forward. Very good. And I can see that there's not a curvature in his spine or anything, and he moves freely with that. So, and that concludes our head to toe assessment. Thank you for letting me do it on you.
Thank you.
So I'm also going to listen to the heart with the bell of my stethoscope. Okay, and I can hear that S1 can be heard best at the apex of the heart, and S2 can be heard best at the base of the heart. And I was also listening for any bruits or abnormal sounds, and I did not hear any.